Good morning. My name is Ralf Friedrichs. I'm an author, addiction recovery coach, life coach, and the host of this show, the Take Your Life Back Today radio show, in combination with the YouTube video version on channel Take Your Life Back Today show on YouTube. There is more evidence that the opiate epidemic is only getting worse in the U.S., as a matter of fact, in the entire world. The crisis is costing the U.S. more than $500 billion per year. Medical care for those abusing opiates can cost $28 billion per year on its own. The opiate epidemic just keeps getting worse. Approximately 71,568 predicted drug overdose deaths were reported for the 12-month period from January to December. Folks, from January to December was 67,000 people died of opiate overdoses. That is unbelievable in numbers itself. The predicted number of deaths from drug overdoses rose 33% just in Nebraska and 24% in New Jersey over the same period. Nebraska had the largest increase, but it also is one of the states with the fewer numbers of drug overdoses. Only 152 reported deaths happened in a 12-month period in the state of Nebraska. In North Carolina, there were 2,500. 12 states have seen a drop in overdose deaths year over year, most of which are in the Midwest and Rocky Mountain regions. Wyoming saw the greatest drop at 33% for a 12-month period to January and has one of the fewest numbers of predicted cases at 61 for the 12-month period starting in January till December, down from 91 from the same period a year before. White Americans seem to be at the greatest risk for death by opiate, according to the study published in the American Journal of Preventive Medicine last year. The rise in fatal drug overdoses is almost entirely responsible for growth in mortality rates for white, non-Hispanic people between the ages of 22 and 56 years old. The rise in fatal drug overdoses is almost entirely responsible for the growth in mortality rates for white, non-Hispanic people between ages 22 and 56 in the most recent years, according to the new study published in the American Journal of Preventive Medicine, my friends. Folks, it's become an epidemic. Mortality rates for the population rose by 21.2 deaths for 100,000 people between 1999 and 2015. The study found that if drug mortality rates had stayed at 1999 levels, mortality rates would have actually declined for men in the population considerably and risen only slightly for women. Recent analysis by the Centers for Disease Control and Prevention found that recent increases in drug overdose deaths are driven by continued sharp increases in deaths involving synthetic opiates other than methadone, such as illicitly manufactured fentanyl. And all races have shown an increase in opiate-related deaths, the CDC found. No area of the United States is exempt from this epidemic. We all now know a friend, family member, or loved one devastated by opiates. CDC Principal's Deputy Director Ann Schuchat said in a statement, from 2015 to 2016, opiate-involved deaths increased among men, women, people above the age of 15. Whites, blacks, Hispanics, and Asian Pacific Islanders. The CDC said the largest relative rate happened among blacks, 56%. Of the estimated 50,000 Americans who died of drug overdoses in 2015, some 63% involved opiates. The same year, more than 33,000 Americans died of drug overdoses involving opiates, according to the report from the Council of Economic Advisors, an agency that is part of the Executive Office of the President. That's more than quadrupled the rate of overdose deaths involving opiates in 1999. According to the CDC. President Donald Trump has declared an opiate epidemic a public health emergency. It has ravaged some communities across this country, but it isn't just killing people who have become addicted to these powerful pain medications. It's taken a financial toll as well. Some of the areas seeing the most overdose deaths are Southwest and Northeast Ohio, Eastern Kentucky, Western Virginia, and Western Pennsylvania, according to the Federal Reserve Bank of Cleveland. Some estimate put the nationwide cost at $500 billion. The economic cost of the opiate crisis in 2016 was $504 billion, much higher than previous estimate, according to the report from the Council of Economic Advisors. When taken, healthcare bills, criminal justice costs, and loss of productivity, the opiate epidemic is costing Americans billions of dollars a year. Nobody has seen anything like what is going on right now, Trump said in his speech in October. As Americans, we cannot allow this to continue. It is time to liberate our communities from this scourge of drug addiction, he said. Opiates are killing tens of thousands of Americans each and every year. They include prescription pills, including Vicodin and Oxycodone, as well as heroin, fentanyl, and a drug that can be injected and taken through a skin patch or as a lozenge. Folks, Trump declares opiate addiction public health emergency back in October. President Donald Trump on Thursday declared the opiate crisis a nationwide public health emergency and said, "We could be the generation to end the opiate epidemic." Mr. Trump also cited his late brother's battle with alcoholism. And you know, that's why Donald Trump doesn't drink or do anything like that. One city is looking to pay back. New York City Mayor de Blasio said that city is seeking about $500 million in lawsuit against opiate manufacturers and distributors to recover some costs New York has suffered as a result of opiate abuse. Opiates have put a financial burden on the city, increasing the use of drug treatment services, inpatient hospital services, medical examiner costs, criminal justice costs, and law enforcement costs. That's what the city official said. Those costs include about 45,000 emergency room visits per opiate in 2017 and delivering NARC to prevent overdoses. An analysis by the National Center for Injury Prevention and Control published in the journal Medical Care in 2016 estimated the cost treating overdoses, abuse, and dependence on prescription opiates alone cost American society some $78.5 billion per year. It crunched data from 2013 when some 2 million Americans met criteria for prescription opiate abuse and dependence, and some 16,000 died from prescription opiate overdoses. To put the figure in context, the U.S. spent $79 billion on Supplement Nutritional Assistance Program, SNAP, that same year, the researchers said. But the new analysis from the CEA is higher because it goes beyond conventional methods to account for the value of lives lost, the authors of the report said. Plus, since the previous studies, the opiate crisis has worsened and has caused more deaths everywhere. Even before the CEA's analysis, the estimated costs of the cities and their crisis were staggering. Patients with untreated opiate or use disorder tend to happen and cost $18,000 per person a year. In 2011, the numbers were inflated by 114%. One study from the Beth Israel Deacon's Medical Center in Boston found that the average cost of treating an opiate overdose victim in the intensive care units jumped 58% between 2009 and 2015. As an addiction persists, patients arrive in worse condition and require longer stays. In 2015, average cost among 162 academic hospitals was $92,000 per patient in intensive care. Criminal justice, the U.S. spent nearly $8 billion on criminal justice-related costs due to selling, consuming opiates, which is almost entirely cost the state local governments, according to the National Center for Injury Prevention and Control study published in the Journal of Medical Care. Worse, the drug rate for addicts is around 45% within 3 years of prison release. 3 years after they get out, they're back to business. The cost in lost productivity is about $20 billion. 2015 study found some 7 in 10 employees have felt some effect of prescription drug use among their employees, including absenteeism or decreased job performance, according to the National Safety Council, a nonprofit based in Illinois. And fatal overdoses cost $22 billion in healthcare and lost productivity costs. Unseen costs, of course, saw that these costs are actually created within the first 3 years of either being released from jail, released from hospital, or after saying that they had quit. As Trump said Thursday, no part of our society, not young, old, rich, poor, urban, or rural, has been spared this plague of drug addiction. Doesn't matter what your profession is. You could be a judge, you can be a lawyer, you can be a doctor. Call me at 844-405-HELP. Together we can help each other take our lives back. Be good to yourselves, be good to each other. And remember, a simple smile to a total stranger can change their life and can even change your life. May God bless each and every one of you. If you have a family member that is addicted to drugs or alcohol, get them help immediately, because it will kill. It does kill. It's shown it will kill.